going? Sorry about the wait. Computer. Maybe pull the couch around. I'm happy to sit on the wheelchair. You just don't know. I'm happy in a wheelchair. Okay, you can have a wheelchair. Yes. All right. So my name's Joanne. I'm one of the doctors. I work for Christopher Zenos, who is the surgeon. Yeah. And I'm Jodie, social worker. We've met.
And I'm Kay, one of the nurses. Hi. Hi.
We've got Dennis, we've got Grace, we've got Maria, and Dan. Very good.
And my children. Second and the third, the oldest is still working in the city.
So, I mean, we know you're doing very well, okay? So the surgery went very well. Christopher Zenos or one of the other doctors would have explained to you that they tried to get out as much as they could, okay? It was difficult because of the area in which the tumour was in. Right down at the very end of the tumour, it was a difficult area to get to, and it could potentially be dangerous in terms of vessels and other areas of the brain. So they got out most of the tumour, all right? It looks like there still is an area that's left. We'll be able to tell more about that once we get a scan in a few months' time. But, I mean, the most important thing is we know that you're doing well. Okay. In terms of the pathology results, what happens here is we get results that are sort of preliminary, and then we confirm them when we discuss them at a meeting in a few weeks' time. We have a very big pathology meeting where pathologist from outside the hospital as well comes, and she's a specialist in neurosurgery, and that's when we confirm the results and we talk about whether or not you might need any other therapy. Okay. So the lesion looks like it is one that comes from the brain cells. Okay. It looks like it is what we would call a lower grade one. All right. Yeah. But I can't say that for 100% till we confirm it in a few weeks' time. Yeah. All right. So in a few weeks' time, we would see you in our outpatient clinic, okay? And we will just confirm those results after discussing them at the meeting. Okay? I mean, so from here, from a medical point of view, we know that you're doing 100% great. In terms of whether or not you go home, that's entirely up to you. I'm happy for you to go home if you feel you're able to go home. So that could even happen today if you want to. Yeah. If not, you can stay one more night and go home tomorrow. I'll leave it up to you.
Always comes here at 6 o'clock in the morning and leaves me at 8 o'clock at night.
It's lucky that you have so much support.
So does it mean that it's benign? Or?
It's not what we call benign. It's what we would call a lower grade lesion. But at the same time, as I say, I need to confirm that in a few weeks' time. Whether or not something's lower grade or if it's a bit more higher grade usually predicts how fast or slow it might grow, and also dictates whether or not we give other therapies such as radiotherapy or chemotherapy. We do also have to keep in the back of our mind that when something is a lower grade lesion, there is a possibility and in the future that it may transform into something that's a bit more aggressive. Okay, that's not something that you need to worry about. That's not something that you can prevent from happening. It just does happen in a certain proportion of people. Okay. But in saying that, we continue to monitor you for a very long time. We're going to see you in our clinics with follow-up scans to make sure that everything's okay.
So is there any restrictions of what you're going to do?
So in terms of restrictions from now, when you go home, you do your usual activities. You have to know that once you've been in hospital and you've had big surgery, I mean, you're doing amazingly great. You've had a really big operation. You'll find that you want to do lots, and you might find that you're a bit tired, and that's completely normal, okay? So you can be tired for quite a few weeks from now, because your brain's had a big impact of having very big surgery, okay? You just need to take it slow, you need to let people help you, and it will slowly improve with time, okay? The other thing, you shouldn't really be driving for at least 6 weeks, okay? Because you've had a big operation. Not working.
I need the doctor's certificate for that because I'm applying for a disability pension. So they're waiting for the report of the doctor. My GP already filled out the other forms, but the one from you guys, they also need that because it is you can tell them for how long. So the GP doesn't know for how long anyway. So
how long is it? How long enough work for.
Well, that's going to go on how you feel for starters. Remind me what type of work you do.
I am an assembler. We're assembling a cardio pack.
Okay.
Yeah, all the things you need in the theater room for heart surgery, that's what I'm doing.
Okay, and is that in a factory or is that a
In a
sterilization?
factory, yeah, in a factory wherein I assemble and I use my right arm to assemble everything.
Okay.
Yeah, and reading like the drawing, we read that, we follow what's in there, and from there we assemble everything.
Okay. I would have thought that at least 6 weeks
Because
off
I
work
can
is a
do
good
that.
idea. In about 6 weeks' time, you're going to see us in the clinic, and that's when we can chat to you about how you're going and work out if whether or not you think you're ready to go back to work.
Okay.
Also, from here, I hand you over to Kay that can talk to you about what happens in terms of seeing the oncology clinic as well.
Okay.
What about her dressings?
Yeah,
What's
so
gonna happen?
the dressing, we can change that before you go. There are staples there that stay in for at least 7 days after surgery, and you get those taken out by your GP. Okay, so we send a staple removaler with you.
Okay.
Okay.
So she can go home now.
If you want, if you
That's
want
up to
to.
Grace.
Yeah.
And medication, yes. Ongoing care.
Usually a week after
Yeah.
surgery.
Okay.
And the other decks as well.
We're weaning it down.
Okay, yeah, because I can't sleep with that one. I really have a problem with Dexa last time.
Yeah.
And look at my face. And I've been asking them, do you want a piece of my face? It's too heavy now, I said. And I'm eating a lot. I can't stop eating.
So
I
the
don't know.
swelling is also from the swelling up here is tracking down into your face, okay?
Oh,
But it's
that's
so much better than it was originally, so it's
Yeah.
definitely improving very fast.
And all this is just going to kind of die down because all of a sudden that side's gone swell.
It's completely normal. You've got an incision right across, so that'll all settle down.
I feel like it's a bit heavy on the spots here now, but in here I have no problem. With
okay.
regards to vision and everything, I'm alright. Compared
better.
before that, I have like a blurry vision,
Yeah.
but after the operation, good.
Just what you were talking about before about working. Have you got sick leave and holidays and all the
I
long
have
just
used everything.
everything? So
I
you're are you
yeah.
resigning from work, or are you just
No,
saying
there-
you can't work
Because
to something with a pension?
actually, yeah, unfortunately, I've got a tennis elbow problem from work. Yeah, before I had it,
Before-
so I'm on work cover.
Anyway.
Yeah,
okay.
I'm working like 3 hours a day, only light duty,
Okay.
and it's gonna be a year, 2nd of June. So they're terminating now. They're terminating me from work.
Anyway, on the
Yeah,
2nd of
because
June.
they
Okay,
can't
so
give
that's
me
fine. Okay.
light duties anymore.
Anymore. Okay. So regardless of this, you would
Yes.
you would finish your job.
Yes,
Okay. All right.
yes.
So then apply
we
for
can
the
get you a special Centrelink medical certificate.
Yes.
I'll keep
If
one
you
of those
could,
for
yeah,
doctors.
thank you, yeah. Because if I will be able to work like 15 hours a week, and then I will not be able to have any assistance from Centrelink.
Okay.
Yeah.
All right. Yes.
In 6 months' time, can she travel overseas?
Yeah.
It's very difficult. What we've got to do more we've got to do more testing on the tumour before we know exactly what type of tumour it is. At the moment, as the doctor said, it's looking like a low grade, but we do need more testing on the tumour, which can take quite a period, days to weeks. Joe, if you need to go.
Is that all right?
Yeah,
I'm just
absolutely.
at the end of an
That's, I
appointment.
know. Is there any
Sorry.
questions
That's
for
all
the
right.
doctor? But I can go everything, and if I, I can
You're
stay. No, you go,
right.
Joe.
Yeah.
So we can
Yeah.
get all those forms sorted out for you.
Yes,
Thank
before
you.
we go
I'll
today.
do all of that with
Thank you
after
very
this
much.
meeting. I'll get the
No
one
problem.
the other
Thanks,
doctor.
Joe. Very much.
Thanks, Joe.
Okay. Yeah.
Thank you.
I just lost my train of thought.
Yeah.
You were saying,
Travel
Overseas.
oh yes, okay.
Yeah,
So we're
yeah.
needing more tests on the tumour until we get that exact
But
diagnosis.
that's still
no,
in 18th of December.
Okay, yep, I'm getting there. I'm just working out. So we need to know more exactly what the tumour is. Once we know exactly what the tumour is, we'll then get you to see the correct specialist depending on the
Yeah.
tumour, then we
Yeah.
get the, okay.
And then if she needs a radiotherapy or
Radiotherapy or
whatever.
chemotherapy, or sometimes with the low-grade tumours they just watch them and they do regular MRIs. Sometimes they might do radiotherapy, sometimes they might do chemotherapy. But I've spoken to one of the specialists today and he said don't say anything because we don't know yet.
don't
We
know
do
yet.
need more
Okay,
testing. And I
yeah.
know it's
Alright.
frustrating
Yeah,
for you
of
because you
course,
don't
yeah,
know.
yeah, yeah.
So until we know about that, then we'll know more about the
Yep, we understand.
Then we would be saying, I would be saying, we've got a clinic here it's just called the Brain Tumour Clinic
Yes,
every
yes.
Wednesday afternoon, and we'll be making you an appointment there, depending on which specialist you need to
I need to
see.
see,
Yeah.
yeah.
So I'll speak to the specialist in the clinic tomorrow and show him your preliminary results, and then I'll say to him, where would you like the appointment to be, and then I'll give you a ring, okay, as in when it will be and where it will be and who with. But depending on whether they will want to give you more treatment will depend on what's going to be happening at December. Do you know what I mean? Because so that's why I don't want to promise that, but keep on reminding all the doctors that you want to do that. Have you bought a ticket?
Yes, already.
Okay, so where are you going?
18th of December in the Philippines.
Philippines. For how long?
For 1 month.
1 month. Do you have travel insurance?
Yes.
Oh, good. That's a good thing. So
That means we can get the,
well,
just in case.
this is if it's not called a pre-existing illness if you've already bought the ticket, this should be covered. So you could, if for some reason you couldn't go, at least you can get that refunded.
For all the tickets, just for myself.
Well, it would depend on what your insurance is. Generally it's for anyone travelling with you, but you'll have to read your policy, which one you chose.
And I can always do a letter for you as well,
Yeah.
just
Thank you,
supporting what's
yeah.
going on.
Please,
So
if you could
before
do
you leave
that.
today as well, I'll give you my card as well. Even if
Oh,
it's
thank
months
you.
down
Thank
the
you.
track, feel
Yeah.
free to
Yeah.
call me
Thank you.
if you're having any difficulties and if they want some sort
Because
of supporting
I still
letter
got
from the
the idea.
hospital,
Yeah.
I can do that.
Yeah. Okay. Sorry.
Because I've got my 6 sisters and a brother in the Philippines. I haven't
Your
seen them
what,
for
sorry?
12 years.
Your what?
Six
Sister and a brother.
sisters
Okay,
and one
No,
brother.
look,
Six sisters.
we
Oh,
would,
wow.
we would be trying. We would do everything in our power to get you there, but I just would be silly to
hopefully,
promise you now
yeah.
so early on.
Hopefully
Yeah.
I'll
Okay.
be able
All
to
right.
see them
Okay.
because I haven't seen them for 12
That's
years.
wonderful.
And
Okay.
that's something to sort of negotiate
With
with
the
the
doctors,
doctors when
yes.
you're having all the
Yeah.
outpatient clinics and looking
But
at what.
of course, if I can't, I can. I'm not going to push
Well,
them.
Well,
No.
might be able to reduce, like,
Well, no,
what you said,
just
going for a
it's
month.
only a month. We'll be able to avoid it. I'm sure.
Yeah.
I'm sure it won't be a problem. I just
Yeah.
don't want to promise
Even
you
to-
until
even
we know.
just to spend
Gen-
Christmas with them and then
Generally, it's
yeah.
easy. We can work treatment around it, but we have to wait and see because we need to see how you are too. And once we know what the tumour is, it's going to give us more of an idea about what your type of tumour in the population does. But we never know what each individual person's tumour is until we watch it. So that's why we would be following you very closely, doing
For the
regular
meantime,
scans.
what you're gonna do? We're just gonna. I mean, are you just gonna contact us to?
Yeah, as I said,
for the
today you can go home, and then as I said, I'm going to talk to the specialist tomorrow and get an appointment, and I'll ring you before the end of the week with the contact information. So, and I'll give you my number in case I forget, and then you ring me. All right. Yes. Okay. All right. So that's good.
Just a really quick
Yes.
question. In terms of her head, I know they said that they were going to replace that one
Yep.
part. Do we need to do anything in terms of cleaning it or anything?
We'll get one of the nurses that work on this ward, because I'm actually coming from the clinic, who'll change that and ask them all the questions about
Oh,
it.
okay.
All right, because they're the
And
experts.
what about her medication?
Yes, and,
The
and all the
pharmacist
medication
will
that
come
will,
and do all
the,
of that.
the
Okay.
girls from the ward can
Okay.
organise all of that.
Okay.
So
Alright.
as far as home today, the girls on the ward will come. We'll tell them after we finish that you're ready to go home.
Yep.
All
Grace,
right.
are you happy to go home today, or
Yep,
would you
yep.
prefer to stay another night? It's your decision.
Yeah, I'll just go home
You
tonight
happy to go
because
home?
it's too much for my husband already. I think.
If there's no medical reason to stay, you're better to be at home. Yeah.
It'll, after this, what I'll do is I'll go let the nurse in charge know that we're planning for you to go today.
Yeah.
We'll get all your scripts and your medications and things sorted.
And the
We'll get
certificates
them
as
to you,
well.
the
Yep.
dressing, the certificates. So it might be another hour or so while
Yeah,
you,
that's
you
all
know,
right.
get all of that
That's
together,
okay.
but at least you know that you can definitely go
Thank
today
you.
as soon as we get all of those things
Yep.
done.
And do you want to stay? Or?
I might go and start
Yes,
all of
that's
that
what I thought,
process.
while I
and
go
I'll bring
over
back
some
my
of
card
this.
as well
Yep.
for you, alright?
Thank you.
So I'll,
Thank
be,
you.
I'll be back. I'll see you before
Thank
you leave,
you.
okay?
Thank you.
Alright.
Now I've got some information written here. Just important to remember that this is about all types of grade tumours, about low grade and high grade. But there's some good general information that's in here. Some people want to read every single thing they can get their hands on, and other people would rather just listen to what the doctors tell you. But everybody will work differently, okay? And I'm sure once we get the name of the tumour, you'll be Googling madly. And that's
Yes, of
why this
course.
is important. It's probably better to stick to medical because you'll get everything wrong on the internet. But we don't really want to give the preliminary name. We'd rather wait until we know definitely, not to confuse them.
Yes.
All right. Okay. So there's a very general information there. Okay. So it's important that even though most of it's been taken out, there is still some in there, and that's they've always got to balance up the damage they'll do by digging in deeper to the brain to remove the tumour rather than going as far as they can to keep you well. You know what I mean? Yeah, so that's why they have to sometimes they can see that there's a blood vessel very close, and if they tried to get it out, it could be
that's
very
what they
dangerous.
explained to
Or
me
they might
last
that it might be near a speech or a movement area, and they wouldn't want to cause too much damage. But I thought the doctor said that it was just in the area they could see that they'd gone far enough. Yeah, just as you know, if you're removing something with the arm and you go a bit too far, it doesn't matter. Whereas the brain is very vital, so they're always balancing up how much do they take and not. Yeah, and it's all those things and the final pathology. And how you are, all those things they sum up as to who gets what treatment. So we've got to wait. They also sometimes like to wait to see how much you recover from the surgery.
And I think I'm doing good.
You're doing very well. That's right. Okay. So there's a very
I eat a lot.
yes, that's the dexamethasone, yes. So there's a general one on living with a brain tumour and coping with your loved one's brain tumour, okay? So that's for you, and caring for someone. As the doctor said, sometimes after a big operation or even just being in hospital, having an operation, people can get very tired. So there's a little thing about tips to do. It's not like a tired when we've been to the gym sort of thing. It's not, you tend to just got to go with it. You can't fight through it. You just sort of, if you're tired, have a rest. Just understand your body's had a big assault and it can take you a while to recover. But there's no time, we can't even tell you a time because everybody's different. Some people go home and are fit as a fiddle, other people are exhausted for a few weeks. So it's just very individual. Listen to your body. It will tell you. Don't stop and wrap yourself in cotton wool. Get out and about doing as much as you can, you know, within reason. Yeah. So
she was like, she
can't
wants to sing on Friday or something, and I was like, why?
sing
like,
what?
she's got like a performance or something.
I'm not going to.
Friday's a bit soon to do anything other than sit on the couch, I think.
Yes. That's what
I have a choir in the church.
Okay.
Yeah, we always sing in the church.
Okay.
So sometimes I play the keyboard, he plays the guitar, and I
This
sing
is on Saturday.
on a Saturday night.
I would say this week, don't.
Not
It's very soon. If you feel well, go and listen. Use that as an outing and just say, and then before you do the following week, I'd be singing at home because singing is quite pressure.
Yeah,
You're putting pressure, and it's just had a lot of it's not going to hurt you, but we just don't want. I want to give you the best chance of quicker recovery. There's no point putting your body under a stress it doesn't need.
6th of June.
Well, too far. No, as I said. So let's just this week go and listen. Next week, see how you're feeling. As I said, some people are exhausted, other people as fit as a fiddle. So we can't commit to a date until we know how you are. So I would try. I would try going first. Then if you got to sing, then I would try singing the songs at home. If you're trying the keyboard at home, if you were going to sing one song and then be sitting down, that might be okay. But if you're playing the keyboard sitting, standing for an hour, that might not be okay.
Yes,
do you know what I mean? So it's just summing it all up.
Well, I mean, because we're going to attend a party. I mean, a wedding party next week, not this week.
The following
Is she
On the
allowed to?
6th.
Yeah. Well, what do you mean?
Just
That's what I said.
A wedding.
That's
She already
a wedding.
said.
So going to a
Yeah.
wedding. Okay. So see how you feel. It's not going to hurt you. Okay. So don't worry. You can't damage yourself by going. But see how you feel. If you're feeling fit as a fiddle, then on Monday go and have coffee down at the coffee shop for half an hour. On Tuesday go and visit someone else for an hour. On Wednesday do a little bit more. You'll know yourself by the weekend. And I would say
in the park. Okay?
slowly, a little bit, just a little bit. So listen to your body. You can't. You might just choose to go to the church and not the reception, or an hour of the reception, or your body will tell you.
Yeah.
You know.
Is there still a possibility for her to have a seizure?
There is always, whenever you have damage to the brain, and you will always, for the rest of your life, no, it was in 6D, I put it back in the medical thing. Oh, well, I put in 6D. There will always be, your brain will never be like it was,
Like
because they've
it's-
cut it out. You've had an operation, so they've cut an area of your brain out. Okay, so and there is a bit of tumour left. So seizures can theoretically happen any time. But it's we're not. Hang on, sorry, just slowly. So we're not expecting it. That's important to say. It's possible. I would be wrong to say it can't happen, but it is possible. You might never, ever, ever in your whole life have one again.
Yeah, before the surgery, I didn't even have one.
That's right.
Yeah, very
That's
lucky.
right. Exactly. And you might never, ever, ever have one. But it would be wrong of me to say you won't. Yeah.
Yeah,
Okay.
but it's good that
nothing
we at
we're
least-
expecting. Nothing. We don't tell families about seizures unless someone has had a seizure. So that's how little we worry. Okay. So we would not even bring it up. You haven't had a seizure, have you?
No.
No. You're on the
Yes,
Keppra
no.
just because you've had the operation. Exactly. Okay. But if you did notice, seizures can be anything from just sitting in the chair staring into space for a minute and then coming back and being good, to a full collapse on the floor with the whole body shaking. Okay. All right. Don't worry about it. We are not expecting it. So
Because
that's
most
okay.
of the
We
time,
would never
I'm
have brought
just
it.
with my youngest
Yeah,
son.
we would,
so that
and
he
there's
understands.
hundreds of thousands of epileptic people in the community that are living normal lives, live on their own, work, and you have to just move. As time progresses, you'll adjust to that. But if you hadn't have brought it up, we would not even mention it, because it's not something that we believe is
But
high
theoretically,
chance.
if it did happen, what would we
Well,
do?
as I said, it depends on if it's a staring into space and then 30 seconds later she's fine, or whether it's a full collapse on the floor. Okay, if it's a full collapse on the floor, then you move. Don't leave mum alone. Move anything, furniture away from her.
Yeah.
So, and I would ring an ambulance immediately. Okay, because it's the first one. Yeah, and then you would need to go on medication. Yeah, if you having anything that you're concerned is not normal, mum, like staring or speaking funny or her arms weak or anything at all unusual, we say ring us, because we don't want to give you a list of things that might happen. It's very worrying,
Yeah.
and we don't know what's going to happen, because it depends what part of the brain is irritated, as in what part of the brain, if you're going to get a weakness or a seizure or So we just say, I know this is a horrendous time, you will slowly adjust as day after day after day, week after week, month after month change, and mum's well, you'll relax, I know. But of course it's a very distressful time. We just say, if you are worried about anything, either get straight to the local doctor. I will be giving you my telephone number. There's a team of nurses that you can ring Monday to Friday business hours, but you can always, if you are really worried, mum's very sick, you just call an ambulance. Easy. Come here, and then the doctors will deal with it downstairs. And if it's just something that is a little bit weak, but then it gets better, or mum's just not quite herself, pop down and see the local doctor.
Okay.
And they can ring the hospital if they're worried as well. So rather than sit home worrying, we would rather you ring and check. Yeah. All right. So don't sit home worrying about seizures. I'm not saying you won't have one, but we're not worried. We're not worried. So all right. Yeah.
And she can lay down on the bed. I mean, an
You
ordinary
can
bed.
do anything you like as long as your body's telling you that you're okay. Yeah, it's lying flat, sitting up, not a problem. Okay. All right. Okay. And if you have the odd headache in the next couple of weeks, don't worry. Take some Panadol, and see if they're persistent and getting worse. Then absolutely give us give me a ring. All right. Okay. I would go down and see your local doctor in the next days or week or so, so he's there up to date with what's going on, because they need to know what's happening. The hospital will send them a letter, but it may not be there for a few weeks. So but I think
Sorry.
maybe bring it back. So just pop down and say, look, at the minute they think it's a low-grade tumour, but they're waiting for the final results, and then they're going to follow me up. And if he was worried, I've written my telephone number here in the book. You can give it to him as well. Okay. So I'm Kay Walsh. There's 2 or 3 of us in the team. So the way to get the person that's doing the job on that day is you ring the hospital switchboard 95946666. You know how when you ring it's press 1 for this, 2 for that. Press 6 straight away, which will get you the operator, and ask for pager number 1246. So whoever's doing the job on that day will answer the phone.
Okay.
They all have access to our notes and the hospital notes, so they may not know you particularly, but they'll look up your notes, find out your answers and get back to you. All right?
Thank you, Kate.
Okay. So I would rather you ring me every day than sit home worrying. All right? So if you have any questions, I can allay your anxiety very quickly, or say, no, I think let's pop down to the doctor and get that checked
Thank you,
out.
Kate.
But you don't have to make those decisions yourself in this,
Yep.
So through the whole process, you'll be heavily monitored.
Yeah.
Monitored.
All right? Okay. All right. Okay.
Yep.
All right. So that's just a bit of tiredness, but you've recovered from this so well that you may find that you just need to take it easy for the first few days. What we would say is like, tomorrow don't walk all around the block, just maybe tomorrow just hang out in the house, and then maybe the next day wander down to the corner and wander back again. You'll soon know if what's too far and what isn't. Okay. But the worst thing also you can do is just sit inside and
I don't want to
Watch TV.
well, for weeks, now, what can trigger a seizure? I normally take that out for people that haven't had seizures. Okay, but so I can leave it in if you're worried about it, and then you can, But it's, these are for someone that has seizures, not for someone that hasn't had seizures, So I think probably let's leave it out. That will cause more worry than, some people that have problems with a brain tumour and surgery can have some memory problems.
I was already having that before.
You always have it before.
Operation.
So I suppose that can return, your memory can return. Sometimes it doesn't return right back to normal. Only time will tell
I'm
on that.
talking to my friend, and I really can't remember her name. It's a shame.
It can be very hard making those adjustments for yourself, but also for your family, making adjustments to mum that isn't exactly the same as she always was. That can be a bit hard too.
Before I can recognize his face. He's my husband. The surname is Ramos, but I can't remember his name anymore.
But you can now. Oh, you?
No, she's just joking.
Oh, okay. Okay. So
at least I know his surname is Ramos because I'm Ramos, but the first name.
But
you're
okay
worry
now.
about it.
Okay, good.
She's just
Good.
joking.
Good sense of humour. We like that. So I think just. We hope a lot of it will return, but no one is ever going to be able to tell you what's going to happen. We just take it. No, that's right.
Yeah, hopefully whatever is left there doesn't grow up anymore.
Well, that's where we'll know more about the potential of it growing when we know what type of tumour it is. Because the lower grade tumours tend to grow a lot slower than the higher grade tumours grow a lot, So let's wait till we get more. I know this is frustrating, but let's wait till we get all the information so we give you the correct. Only 5 years ago, we didn't even do this extra testing. So even it's all very new. They've got the capabilities to tell us more about the tumour. So that's a really good thing to know. And they talk constantly with everyone in the world, so everyone treats tumours the same way. So you wouldn't get better treatment anywhere else in the world. So that's always good to know as well. Okay. The only thing we always say is, without being negative, anyone that's got anything to do with the brain, we always say it's good to get what we call your affairs in order. So just in case your memory at some stage in the future wasn't as good as it was, it's always good to organise wills now and power of attorney, medical and financial. So that we say this to everyone that walks in the front door of the hospital as well, so it's not only people that have got brain tumours. We just say once you've had an illness, a serious illness with a serious operation, it's good to get all those things done now, because then they're done and you can forget about them. Because if something happened, not with you, but with somebody, and they couldn't think quite like they normally could, it's too late to get the power of attorneys done. You have to have a clear mind to be able to sign legal documents, so that we just say to everyone, get them done, then they're all organised. all right? So that's not being negative, it's being clever.
Yeah.
Yeah, all right. So don't look at it as a negative thing more than a positive thing. Yeah. So there's some information. Medical power of attorney is just about if you can't make your own decisions in medicine. These are yours, yeah. In medicine, then somebody else makes it for you. Generally, the whole family does, but it's always good to have one person. Yeah, and then with a lawyer, you can do financial power of attorneys as well, so that if you couldn't make decision about your finances, you've signed the piece of paper that somebody else can. Yeah, so it's just handy to have that done. We always say, look at it as a positive thing moving forward. Yeah. So my number's in the front of the book, but I'll ring you hopefully Thursday and we've got all your information, I'm assuming, in her notes. Is it? We've got you, Dennis? Yeah. All right. Anything else?
No, we just need to speak to the nurse.
Yes. Oh, yes. Well, I'll go out and tell the nurse you're ready to go home. We just need your dressing change. You need to take the stapler remover, and you need to ask questions about when can you wash your hair and what do you do, all that stuff.
Yeah.
She's good at that. Then when was your operation? Monday?
22nd.
Monday, that's
No,
right.
no, Friday.
Friday.
Oh, sorry, Monday was the 25th. Okay.
27th.
So just check with the nurse whether you should, they said minimum 7 days, whether you should get them out on Friday or Monday.
Okay.
Yeah, so just check with her, because the doctor said no less than 7 days.
Yeah.
But I just want to check, is Friday right or is Monday right?
And it's my GP who's going to
Yes.
take it.
Yeah, exactly. So just make an appointment, and that's, you can tell him what they've found. Yeah, so maybe, it might be good to make a double appointment so you've got
Yeah, double
time to
appointment,
explain
yes,
everything.
yes.
All right?
Okay. That's
So we'll talk, but if you've got any questions, please ring me. I'm here all day tomorrow.
Thank you.
Okay,
Thank
sure.
you
Thank
so
you so
much.
much.
Thank you.
Alright.
Have a good night.
Okay, thank you.